All right, I'm sorry for that technical glitch, some network issue. You can't really see with these network problems. Okay, now let me come back to the questions because I have some more of them which have been added, and I think our time is running short, so I'm going to go right quick at it. Okay, I think the next question is, can you travel during pregnancy? Well, of course, if you are doing all healthy and fine, and your gynac does permit you, you can travel. The first trimester, I would say avoid. In the second trimester, it's quite safe to travel if you're, of course, having all other nice healthy pregnancy and no complications per se, especially your placental position, your overall health, the baby growth. You should be eating well, eating healthy. You should be fit and fine, being able to do some little walks and moderate exercise without any major issues, then yes, I think should be okay. Flights allow you to travel till around 28 weeks of pregnancy, but every flight has their own rules. So just whichever flight you're planning to take, you can read up. Uh, there are rules and regulations and talk to your gynac about it before you travel. Of course, these are COVID times, so I would really say that stay safe. If you really have to travel, only then step out. If not, then stay home, stay safe. All right. Okay. Uh, all right. Let me go to the next one. Okay. So Sonam Patel is asking, how can one prevent gynecological problems? Okay. Sonam, while that's a very vast question, how do you prevent gynecological problems? Okay. Let's start with this. Say you start with a healthy diet. Okay. What a healthy diet and a moderate exercise will do to you is give you a healthy weight. Okay. So when you have a good healthy weight and you don't have any other uh, obesity related issues, less of medical problems. Now, less of medical problems, less of menstrual problems, less of weight related PCO problems. Now, PCO is one of the most common gynecological problems. Most of you must have heard about, right? Polycystic ovary. So to prevent that, again, have a nice healthy diet, uh, good moderation of exercise, and good check on your weight. And I think a lot of your other menstrual problems and your hormonal problems will also be taken care of. Other gynec problems, well, the other most common gynec problems are vaginal infections that a lot of patients come to us with. Now, vaginal infections usually are related to sexually transmitted diseases also. So you want to prevent it, have safe sex practices. Make sure you always use a barrier contraception along with whatever you want, or if not, also. But for your infection part, for your sexually transmitted infections part, use a barrier contraception. That's going to prevent you with a lot of these gynecological problems, which comes with vaginal infections and vaginal diseases. Again, have a good amount of water, say 8 to 10 glasses of water a day. That will prevent any urine infections from happening. Now, urine infections can give you burning in your urine. If it stays, it might lead to back pressure changes and even kidney diseases. That's quite rare. But then again, always make sure that you have a nice, healthy uh, these problems, and your gynec issues, like the urine part at least, will be taken care of. The other gynec problems that people usually face are, say, they come very late, and come with diseases related to the cancer, like cervical cancers, for example. So if you really want to prevent that, go for regular gynec health checkups. Once a year, pap smears. Take good gynec consults. Get a pap smear done. A pap smear is a very simple procedure. It takes uh, a small something, a stick which is thinner than a straw, all right, and it has a cotton tip end. It just takes a couple of cells from your outside and inside junction of the cervix, and that is tested, and that really helps us to diagnose if you have any abnormal cells or any early cancers. So yes, just these basic few things, go for your regular gynec checks, get a pap smears done yearly, have a nice healthy diet, have good amount of nutrition in your food, maintain your health, as in maintain your weight, and of course, if you want to prevent the vaginal infections, have safe sex practices. I think these would roughly cover up all your major gynec issues, and following these basic principles would help you prevent your gynecological problems. I hope that answers your query, Sonam. All right. And the next is, oh, is dieting safe during pregnancy? Wow, Lakshmi. Well, I wouldn't advise dieting during pregnancy. Of course, you should see if you're overweight and you have a major, diseases like some chronic ailment, and you've got pregnant. So diet modifications, yes, but dieting during pregnancy, well, no. Please meet your gynac or a good dietitian who will help you modify your diet. Nutrition is very important to the baby. You cannot do crash diet or not eat, because all of that is eventually getting transmitted and transferred as a fetal growth. Okay, so your nutrition, your vitamins, your green leafy vegetables, your minerals, all of those are very important. So yes, dieting in pregnancy, well, not, but yes, you should and can modify your diet if of course you have some if you have some obstetrical problems or you have some medical conditions which needs a modification in your diet. I hope that answers your question, Lakshmi. All right, coming to the next one. Uh, she's asked the same question again. So, how does diet during pregnancy affect the baby? Well, diet and nutrition are definitely going to affect your baby. Say, for example, folic acid. Okay, folic acid, not just in your diet, but even as a tablet, like up to 400 micrograms is what's advised by WHO, is very important because it prevents neural tube defects in the baby. Okay, now a developing baby develops the brain, the spinal cord, the whole neural tube. These defects are actually prevented by vitamin B of folic acid, something as simple as that. So your diet is very important. Everything you eat is getting transferred to your baby through your placenta. And that nutrition, that those legumes that you're eating, those nuts that you're eating, those green leafy vegetables, those fruits, everything is giving some form of either mineral or vitamins or just basic calories. Even your baby needs so much of calories. It's a growing fetus. There is so many activities happening. So yes, you have to make sure that you eat healthy, drink nice 8 to 10 glasses of water a day, maintain your nutrition, maintain your hydration, and take your prenatal vitamins properly, because all of that is very, very important for a healthy baby. Okay. All right. So the Navlux here is asking, how can I stop worrying about my pregnancy and what problems can occur during pregnancy? Well, dear, don't worry about pregnancy. That's what the doctors are here for. Yes, we gynecologists are here to worry about your pregnancy. As a mother, you're not supposed to worry about your pregnancy, okay? Enjoy your pregnancy. It's a normal physiological change that a woman is undergoing. Of course, there are going to be changes. They're going to be different, and every step, every trimester is going to be different. But you got to stop worrying about them. If you really want to know the red flags and the problems that can occur during pregnancy, well, if you have any of these the some problems that I'm listing below, if you have any of these, contact your doctor on immediate basis. Otherwise, just be stress free, enjoy this whole journey of pregnancy, because those 9 months you're not going to relive again, of course, till your next pregnancy. But every pregnancy is again different. So this pregnancy is going to be a nice beautiful journey. The red flags, if your once your fetal movement starts, okay, your baby starts moving and you experience decrease or loss of fetal movements, all right, go meet your doctor. If you have vaginal bleeding, go meet your doctor. If you have vaginal discharge which is persistent, some form of discharge is normal, but if it's persistent, it's itchy, it's foul smelling, it's like a warm gush of water, go meet your doctor. That's not a good sign. If you have fever, if you have crampy pain in your abdomen, like you're about to have your periods, that's not healthy. If you're either gaining a lot of weight or losing a lot of weight, that's not healthy. If you're vomiting, all right, and you cannot really keep anything inside of you, if you're having hyperemesis, that is, you throwing up, you have aversion for food, and nothing is staying within, your nutrition levels are getting affected. go meet your doctor. These seven signs are seven red flags. If you have any of these, go meet your doctor according to your symptoms. Of course, a gynac will be checking a lot of other stuff. They will check your thyroid, they'll check your sugars, they'll check your blood pressure, your weight, your fundal height, a lot of checklists that we have to know that you are going on the right direction or not. But that stress part is ours, not yours. Have a nice stress free pregnancy and enjoy and leave all the stress to the doctor. Yes, I hope that answers your question, dear. Okay, she's asking again, what are the chances of something going wrong in pregnancy? Like I just answered, don't really think about it. The chances of anything going wrong when you have any of these symptoms, go meet your doctor, right? Now, say first trimester. All right, just to give you a little this. First trimester, the chances of something going wrong, well, 1 in 4 pregnancies do end up in miscarriages. Okay. Now, nearly 50 to 60% of these miscarriages are because of some genetic abnormalities in the baby. Another couple of them are, say, probably because of wrong implantation or some hormonal issues or something else. Now, if you have any of these, and most of these usually happen early, say about by 6 8 weeks, you get these. Most of the miscarriages happen even before the heartbeat comes, and a lot of times, a lot of patients don't even realize that they're pregnant. They've just kind of passed their expected date of period and they missed it by a couple of days and then they get their period. So they don't even know that they are pregnant. So, yes, the misfortunes of a miscarriage happening or bleeding in pregnancy happening and leading to miscarriage are, like I said, yes, they are a little high. But if you've passed that, if you've got a heartbeat, you've passed that stage, then don't really think about it. Then the chances of a second trimester pregnancy are quite low. They're just about 5%. Yeah, so think positive. Everything's going to be okay. The other signs that you got to be careful, like I just enumerated, the seven red flags. Think about it. If you have any of those, go meet your doctor. And yes, don't worry. I think most of the times things go smooth in pregnancy. Okay. Um, all right. Oh, okay. This is an interesting question. Revati is asking, what conditions do gynecologists treat? Wow. Hi, Revati. A gynae treats everything related to a female pelvic organ. Okay, so that includes anything from your vaginal infections to your vaginal discharges to urinary infections to fibroids, endometriosis, irregular periods, spotting in between your periods, bleeding intermenstrual, you've attained your menopause and you're having menopausal problems. We deal with the menopausal problems as well, hot flushes and night sweats, urinary incontinence. See, your pelvic muscles are weak and they're not really that strong to hold your urine. So every time you cough and sneeze, you're leaking a little bit of urine. We treat that as well. And post-menstrual bleeding, cancers related to the gynecological organs, that's your uterus, ovaries, cervix, everything related to the pelvis is where the gynae comes in the picture. So yes, the gynecologist treats all your female pelvic pathologies. Yeah, I hope that answers your question, dear. All right, Revati. The next question. Okay, so what are the signs of complications during pregnancy? Madhavi, well, Madhavi, dear, I think I already answered this, the signs of complications during pregnancy. If your weight is not really going right on track, if it's really high or really low to start with, you're having high blood pressure. This high blood pressure can translate into syndrome known as preeclampsia. Now, in preeclampsia, you might have this throbbing headache, blurring of vision, your blood pressure really shoots up, it affects your baby, your placenta might get separated. In a very rare case, it might even lead to fetal death or convulsions and fits in the mother. Now, that's something that's not really right. And you know this complication is quite a bad one. So if you're having high blood pressure or any of these signs, you should basically tell your doctor that I have any of these premonitory signs. The other thing is that the other complication that can happen is your sugar levels might go up. Okay, diabetes in pregnancy is quite common, so your doctor will do a diabetes checkup for you, a sugar check for you every trimester. If you are diabetic and you've got pregnant, then of course your sugars have to be within normal range before you conceive. And in the first couple of months, especially. Actually, all throughout pregnancy, you got to monitor your sugars quite regularly. So that is one complication that you got to be careful about. Your thyroid levels also keep changing. So your doctor will make sure that you get your thyroid levels done regularly. Bleeding because of the placental position. Okay, when the placenta that's a little lower, that's called a placenta previa. In the uterus, when the placenta is a little lower than the baby's position, it tends to bleed if you have any stress that is given on it, like a physical stress. So placenta previa, well, there is a more tendency for placenta previa, especially if you've had previous surgery or if you have the fibroid or any previous cesarean scars or any scar for that matter. Then placental position tends to be a little lower. And if it stays like that, it stays lower all throughout until you deliver, then you might be advised a cesarean section if it's not possible for the baby to actually pass through it and come out. I mean, pass on the sides and come out. So depending on the degree of the placenta previa. So that's again one complication in pregnancy that you got to be a little careful about. The other, I think I've already enumerated the hyperemesis, when you are vomiting a lot, when you cannot really keep anything inside of you, you're throwing up a lot, your nutrition level goes down, you have a tendency to get dehydrated. That's another complication that you got to be a little careful about. And if you have a lot of edema, you have a lot of swelling, and the swelling does not really subside on you lying down also. Most swellings in the ankle do happen in pregnancy, but when you rest it out for a couple of hours, the swellings go down. If it stays, it's not really going, or the swelling is there everywhere, all throughout your body, that's not a good sign in pregnancy. These couple of things you got to be a little careful about, and they kind of are saying that the pregnancy is not really going in the right direction. So probably these signs you should uh, have a check about and meet your doctor and let the doctor know accordingly. Yeah, Madhvi, I hope that answers your question. Okay. Rebecca is asking, what are the symptoms of UTI? Well, hi, Rebecca. Uh, a urinary tract infection will give you symptoms like increase in frequency of urine, increase in the pain when you micturate. You'll have that spasmodic pain either at the beginning of the urination or towards the end. You'll have a burning sensation. You will have this hot water flowing sensation. You will have a lot of itching in your vulva or vaginal area. You will have this menstrual crampy pain kind of pain in your lower abdomen every time you pass urine, say either before or after. And sometimes you may even have fever. If it's been persistent and you have a tendency of chronic urine infection, you might even have pain which is radiating up to the loin areas, that is the upper abdomen and back areas. Well, that's not a very good sign, and you should consult your doctor for the same. So yes, these are some of the few symptoms that you have of urine infection. That's increased frequency of micturition, burning in micturition, discharges, crampy kind of pain, fever. Yeah, so just roughly, these are the ones that, when you keep getting them or whenever you get them, go meet your doctor. They'll guide you what to do next. All right. Okay, so Jenny is asking, hi doctor, what is PCOS and how can it be treated? Hi Jenny. PCOS is polycystic ovarian syndrome, and how can it be treated? Well, to start with, what is PCO? Okay, so PCOS, now every ovary has this life. All right, now they have few follicles. Some of them get recruited for the first 14 days of your menstrual cycle. Say you're having a normal 28-day menstrual cycle, considering that. So for the first 14 days, some of them get recruited. One of them increases. By 14th day, it reaches about 18 to 20 millimeters in size. There is this hormone LH, which has a surge. It comes from your brain, gives you a nice little surge peak, because of which the follicle ruptures and an ovum is released. Now, another 14 days, if you do not get pregnant, there is a phase which the ovary, that follicle goes through, that's known as corpus luteum. If you don't get pregnant, it eventually becomes corpus albicans. All the hormone levels in your body dip because the uterus tells the brain, I'm not pregnant, let the hormones level dip. And this is how you get your menstruation. Now, this is a normal menstrual cycle. In PCO, what happens is there are a lot of small follicles, okay? Polycystic ovary. So it's not that you get cyst in the ovary. That's just the picture that we see on sonography. That's why it's known as polycystic ovary. But what you have are a lot of small follicles. All of them are stuck between less than 9 millimeters in size, okay? They are usually located around the periphery of the ovary, and the cortex is quite empty. So you actually see like a pearl of string appearance on a sonography, a lot of small follicles. Now, all of them secrete these hormones at basic intervals. So nothing is basically giving your brain a signal that, I am mature enough to rupture. So your brain does not really secrete any of the LH surges, and there is an imbalance in your hormone. Now, your hormones that usually have an imbalance are FSH and LH. That's your follicle stimulating hormone and your luteinizing hormone. Now, these two hormones, when they have an imbalance, like your LH is, say, 3 times your FSH value, means that your PCO is kind of quite on higher side. And there are, of course, a lot of other blood tests. How do you know you have a PCO? You can get a sonography done on your second or third day of your menstrual cycle. That kind of tells us that, yes, we see a particular picture of a pearls on string appearance, a beads on string appearance, your hormone levels, your clinical picture. Because of these hormones, you might have acne, breakouts, might have facial hair, excess of facial hair, male pattern baldness, male pattern obesity. All of these, they basically uh, tell you that, okay, you might be having PCO, as in there are different criterias. Whenever you experience any of these symptoms, go meet your doctor. We'll see where you fit into the criteria and we'll guide you if you do have PCO or not. The other thing, how do you treat PCO? Well, the first and foremost is lose your weight, maintain a healthy diet, go preservative free, go natural, go organic. That's important. PCO, a lot of PCOs have been related to a lot of these preservatives that we eat, in every food that we are these packed foods and all of those nice preservative packed foods, they just add up to your imbalances. And so go healthy, lose that extra 10% of your weight that you've gained. Just weight loss is very, very important in PCO. Okay, that you will be surprised to know that just a simple weight loss and most of your problems are solved. Well, I forgot to mention the most common problem in PCO is, of course, irregular periods. Like the normalcy of the period is disrupted because now the brain really doesn't know when to give you the period, when to lower your hormones, when to increase your hormones, right? So only weight loss, okay, will go the farthest way to help you with your PCO. So healthy diet, weight loss, a good nutritious food, no preservative based food, these will really help you. And of course, there are a lot of medicines and a lot of supplements that are there which help you with PCO, like inositol and metformin. And these supplements, they really help. But depending on your severity of PCO, we'll judge you, we'll gauge you, and we'll decide your mode of treatment. Yes. So I hope that helps you with your question of what is PCO and just the basis of how it can be treated. Okay. All right. I think Jenny, I think this question I've already answered. Any particular diet to follow during pregnancy? Yes, make sure you include at least 5 portions of nice fresh fruits and vegetables, up to 8-10 glasses of water a day, legumes, low fat, milk and milk products, less of saturated fats, then less of processed food, more of healthy organic food, and yeah, I guess that's about it. And of course, no alcohol. See, alcohol, it's not been proved. Okay. But then I would advise no alcohol at all in pregnancy. Don't take that little bit of risk also that, something might happen or this alcohol might get any other problems to the growing fetus. So no alcohol at all. Decrease your caffeine intake. And yes, eat healthy, stay happy. I think that should be good enough for a diet in to be followed in pregnancy. What are fibroids and how to treat them? Oh, wow, that's a nice big question there. So, fibroids are these muscles that are there in the uterus, and now they can grow anywhere. They are basically a part of the muscle mass itself, which decides to grow. You know how you have a mole somewhere, it's basically a mole on your uterus. All right. Now, that's a very vague way of saying, but it's basically muscle mass which is increasing inside, and it basically gives you a nice lobulated, roundish appearance. So it actually appears like a ball. Now, the size may vary from something as small as less than a centimeter to up to 6, 8, 10, 14, 15 centimeters. Depends on, when you actually go to the doctor with the fibroid. Now, these fibroids can be located anywhere from inside the uterus to the muscle mass of the uterus to the outside of the uterus. Now, depending on where they are the problems that you're going to face. Say they are inside the uterine cavity. You might come to the doctor with a lot of menstrual irregularities, spotting intermenstrually, or if they are lower down, near the opening of the uterus, that's the cervix, the mouth of the uterus, you might experience spotting after coitus, sexual problems, dyspareunia. You might not really, it might be a painful intercourse that you might really experience. Pressure symptoms. If it's closer to your bladder, you might experience increased frequency of urination, urinary infections. If it's closer to the rectum, you might have constipation like symptoms, or intestinal irritability if it's really, quite big and actually falls on the rectum portion of the intestine. Uh, if it's quite big and it's actually outside the body cavity of the uterus, it might be floating around in your abdominal cavity and might twist, give you some pain, may give you some degeneration, some fever, or just if it's quite big, it might just give you like a belly, which, a big belly which is not going. Yeah, you might feel some mass in your tummy and you might feel some hardening, some firmness in your tummy, and you can't really understand why, what is happening. So, whenever you get any of these, like pressure symptoms or menstrual irregularities or repeated urinary infections, or it might sometimes hamper you getting pregnant as well. So if you're planning conception and it's not really happening, and you are experiencing any of these other symptoms, you might just want to check if you have a fibroid. Okay. The treatment basically there depends on the size of the fibroid, the problems that the fibroid is giving you, what stage of your menstrual life are you. Are you really young, or you finished your menstrual cycle? Are you menopausal? Are you planning pregnancy, or are you done with your pregnancy part? All these factors play a role when it comes to treating a particular fibroid. And the treatment options vary from something as simple as leaving it alone to probably a surgical removal of the fibroid. Yeah, so again, the number of fibroids, what problems they're actually giving you, is it possible to cure the problems without really tackling the fibroid, or we really need to tackle the fibroid to cure the problems? A lot of these things come because fibroid is quite a vast topic, and well, a talk in altogether. So if you have any fibroids or you feel that you have, just go meet your gynec once. The gynec will guide you what to do about it. Yeah, so don't really worry, it's not, it's a manageable thing. Okay. I think I'm gonna. All right. So, what medical conditions that affects a woman's gynecological health? I think I've already answered this, Durga. Medical conditions that can affect a woman's gynecological health, say your high blood pressure, your diabetes, your vaginal infections, your urinary tract infections, any breast-related diseases, any breast cysts, masses in the breast, your unsafe sexual practices, all of these. Say some fibroids, undetected fibroids, endometriosis, all of these do affect a woman's gynecological health. And well, if you have any of these, do approach your gynec and ask what can be the best possible solution for the same. Okay, dear. Uh, All right, so Jenny is asking, how can I deal with menstrual irregularities? Well, hi, Jenny. Menstrual irregularities, well, we really got to find out the cause, dear. Okay, so depending on your age, how young are you, or which stage of your fertility profile are you in? Are you married? Are you planning conception? Is menstrual irregularity a problem of you conceiving, or is it that you've already attained menopause and it's now that you're having postmenopausal bleeding, Or is it that you're a young girl with menstrual irregularities and having some other acne issues and hair, excess of facial hair and obesity issue? Well, every reason is different now. The excess facial hair and young could be a PCO. An infertility related, well, the treatment options differ altogether. If you're detected with a fibroid polyp, then the treatment options differ altogether. So, and if you're menopausal and you're having now postmenopausal bleeding, well, the treatment options again are different, and we got to rule out any major diseases. So, while menstrual irregularities, when happen at different stages of life, the treatment options are different. And depending on what your condition is, we got to first find out what the condition is. Once we know what the condition is, we can treat it better. So, yes, dear, I hope that answers your question. And what are the symptoms of unhealthy pregnancy? Lakshmi, dear, the symptoms of unhealthy pregnancy are that your baby is not really growing well, the fetal movements are not that adequate, the fetal kick count is not that good, your height of the uterus is not growing as per how it should be. Your weight is either decreasing or increasing beyond a particular, that's an excess weight gain. I'm sorry. You're having bleeding per vaginum. You're having a lot of excess discharge per vaginum. It's foul smelling, or you're having a water leakage kind of discharge from your vaginal area. You're having this crampy pain in your uh, abdomen, like a menstrual cramp kind of a pain. You're having excessive back aches. You're having a lot of pedal edema, ankle edema, or swelling in your ankles, and a lot of facial edema, or the swelling which is increasing all over your body, or you're having a lot of leg cramps. Well, these are just a couple of symptoms that the pregnancy is not really going that healthy, and you probably need some treatment, and you need to figure out why, what is going wrong, and then probably treat it better. Yes, I hope that answers your question there. All right, I think I still have two more unanswered questions. Uh, okay. Does mother's age have any correlation to baby's health? Oh, yes, of course, dear, it does have. Well, if you take good care of your health, even at 43, like you must have read the papers today, uh, a lot of our actresses and our choreographers, and I'm not going to take names, but it keeps coming every day in the newspapers that even after 40, because they were fit and healthy, they did conceive, they did have a good pregnancy. But yes, age does affect. After 35, the quality of ovum, that's the quality of your egg, uh, is not as good as it is before 35. And the chances of genetic abnormalities do increase after that. After 40, the chances of genetic abnormalities increase considerably. If you're getting pregnant after, say, 35 or 40, you need to undergo, luckily now there are tests which are available. They will help you guide that, is your fetus, what are the chances of your fetus having any of these abnormalities, right? So you can know a particular abnormality in your baby. God forbid it does come, if they are manageable or they are curable or they are not, depending on that. Also, age related, what other problems happen are that your medical conditions might hamper. Sometimes with age, you do end up having some other medical chronic conditions like diabetes, blood pressure, thyroid issues, weight issues. Now, these issues, your obesity, you tend to get more tired, more fatigued. All of these, yes, do reflect on your baby's health as well. Your nutrition aspect also reflects on the baby's health as well. So, these factors, of course, do hamper a child's health. So, age is definitely important, but nothing is impossible, and everything does have a solution, or at least a way out. So, whatever your age is, do approach your gynec if you're planning pregnancy, and they will guide you on what to do and how to go ahead. Yes, I hope that answers your question, dear. Okay, I think the last question for the day: how advisable is it to go for a normal delivery after a cesarean section, and what are the risks? Okay, and that doesn't have a name. Well, if you've had a cesarean section, a lower segment cesarean section, then there is a 4% chance of you having a dehiscence, that is a scar complication, where the scar basically starts separating. when you are attempting a normal delivery. Uh, if it's a vertical section, okay, which used to be done previously, it's not usually done anymore. Or if you've had a really complicated cesarean section, sometimes there's a inverted T incision that we take, and a doctor will mention if you've had a complicated cesarean section, then those complication rates when you are going through a normal delivery increase to about 9%. Now you might think that these are not high. Well, but they're not very low also, because the scar dehiscence, now, if it's detected early, okay, when you're planning a normal delivery after a cesarean section, it's known as vaginal birth after cesarean section. If you're planning a normal delivery and the scar dehiscence is detected early, the doctor will advise you to undergo a cesarean as a and that will be a very quick decision, because before the scar absolutely separates out, or the uterus kind of gives away from the scar region, we have to make sure that we have a healthy mother and a healthy baby. But otherwise, out of say 100, 4 people have this, so 96 people can still go ahead with a normal delivery. But there are a couple of prerequisites for it. Your pelvic should be of adequate width, and it should have adequate space. Your baby should be of an average size. It should be clinically possible when the gynec is examining to have a nice pelvic cavity when we do a nice pelvic examination, to for the baby to be able to come out through your pelvis without any major complications. It's best if you go into labor by yourself rather than having to induce labor pains. So when we induce labor pains, the chances of a scar separating or giving away are more. So if you end up going into normal labor pains by yourself, then yes, there are good chances of having a normal delivery after cesarean section. And of course, you don't have any other complications. Like, if you have some mass which is protruding, if you have a fibroid, if you have any bleeding problems, if your baby's heart rate is really low. So all these, or if the baby's past meconium, it's, the baby's done potty in your tummy, or any other complications for that matter, or your health is not really keeping well, the obesity is a factor. If there is any cofactor, which is also a complicating factor along with a cesarean scar, then well, it is individualized, and you are being given an option, and every patient is evaluated basic meaning on all of these criteria, and then given an option whether a normal delivery, vaginal delivery, is possible after a cesarean section or not. But of course, it is possible. We do it on regular basis, nothing like that. Whenever these criteria are met, there is no particular indication. And of course, the first and foremost, what I forgot to mention is the reason why first cesarean was done. See, the first cesarean was done because the pelvis was short. There was the baby could not really fit in and could not get out, and that was the reason that the baby had distress, and that was the reason that a cesarean was done. There are good chances that if your baby weight is same, you might have the same thing again in your second, and you don't want to give a normal delivery a chance. So depending on the indication of the first cesarean, also we kind of justify if a vaginal delivery is possible or we have to undergo a cesarean for your next. I hope that answers your question there. And I think I have, I, yes, we are done for the day. And I hope I've answered all of your questions. We've overshoot the time by a half an hour more. And I hope Baby Chakra does not really mind that. Uh, I hope all of your queries are solved. And if you have any other questions, please download the app Baby Chakra. Follow me. My code is Nishita, Nishita, Nishita. And I would be happy to help you with any and every questions that you have. Uh, just follow me on Baby Chakra, and of course, I'll be there for online consult as well. So if you still have any doubts, you still feel that some of my queries are not solved, just let me know, and you can follow me. My referral code is Nishita, Nishita. I hope I could help clear a lot of doubts of a lot of people. I was happy to have so many questions today, and all of you just stay safe, and these pandemic times, stay home, stay healthy, stay safe, stay fit, keep smiling, have a nice gynac time. Yes, thank you so much.